How many of you are looking for a great little stretch exercise that's going to help reduce that posterior tilting and give you a great hamstring stretch? We have a 2-for-1 coming up. Alright, so here's our little skeleton model. This is the back, this is your bottom, your butt. What we want to talk about is sometimes the benefits of this exercise right here is to stretch some of the connective tissue that attach also to the hamstring. But what happens is when you have a posterior tilt, this kind of rocks backwards because it's so tight. So slowly you want to be able to, right there, that's the side view, and then get yourself back. And so if this is pulling us down, that's important to understand. But I also want you to consider a couple things here. The nerves run really close. So sometimes you might get numbness or tingling. That's something to be careful for. And I'll mention this again when I show the exercise, but that could be one of the limiting factors to your hamstring tightness. So let's make sure we pay attention to that and not overdo that. But we want to stretch. The whole goal, stretch this posterior tissues in the back of the thigh and then reorientate that pelvis back. Alright, so we're back and I want to show you this great active hamstring lengthening exercise. So what we want to do is we want to set up. It's very important to keep our head down and start looking at our feet. You grab your ankles or as far as you can tolerate, and then you start sliding your butt off the chair and very lightly meeting that tension. You don't want to go past that tension. So you want to go up and then back down. Up and then back down. Up and back down. Now over time, you should get looser and looser. Now if it's numbness or tingling and you're feeling pain, you shouldn't be doing this. And or if it's slowly getting tighter and tighter, you're probably going too far. You just want to meet what we call the barrier and it will start loosening up. Your goal is eventually get this knee straight, like so, and then you've finished. And just kind of walk your hands back up. So it's a great exercise. It gets results quickly. Give it a shot. Isn't that a great exercise to get those hamstrings a little looser, start making changes in that pelvis and the tilting that you might be all having and living with? So make sure this is a safe exercise for you. Like I mentioned before, this might be turning into a nerve stretch. And if you have shorter nerves than you have hamstrings, this probably isn't the right exercise for you. So give it a shot at home. If it causes pain, stop it. If you like what we're doing, please subscribe. Please leave a like and any comments below, or you can choose to email us at rehabandrevivemedia@gmail.com. I'm Dr. Justin Lin of Rehab and Revive. Remember, we can and we will get better together.